Hello everyone, I am Dr. Vasav Nakshiwala, Intervention Radiologist from IR Clinic team. Today we are going to discuss about thyroid nodules. Thyroid nodules are small swelling or lump which occurs in the thyroid gland. Thyroid gland is normally situated in the base of the neck region. These nodules can be solid, it can be cystic, they can be a single in number or multiple in number. Majority of these nodules are benign, which means non-cancerous in nature. Only 5 to 6% of these nodules can be malignant or cancerous in the nature. Majority of these nodules show no symptoms. Some of these nodules may enlarge in size and can cause a cosmetic issue, which is a visible swelling or a lump in the base of the neck. It can cause a swallowing problem or difficulty in breathing, a recurrent cough and a painful sensation in the base of the neck region. In case of radiation exposure and iodine deficiency, there are more chances of developing these thyroid nodules. These nodules are more common in females than males, and in older age groups they are more common. These thyroid nodules can be clinically assessed by local examination by physician. These thyroid nodules can be further investigated with blood test like thyroid function test, which checks the thyroid hormone in your body. This thyroid nodule can be detected on ultrasonography test. It can further characterize into a solid or a cystic in nature. Ultrasonography test can also characterize thyroid nodule further in its cancerous or non-cancerous nature. If ultrasonography test shows a suspicious nature of malignancy in the thyroid nodule, then physician can further order FNSC test, which is called fine needle aspiration cytology. In this test, a small needle is used to take the sample from this thyroid nodule to detect the cancerous cell in the nodule. Now we are going to discuss about the modern technique called thyroid nodule ablation. In this technique, we give local anesthesia in the skin. After giving local anesthesia, we insert a needle inside the thyroid nodule. If the thyroid nodule is a cystic in nature, then we perform chemical ablation. In this procedure, we inject absolute alcohol within the cystic products of the thyroid nodule. And if the thyroid nodule is a solid in nature, then we perform radiofrequency or microwave ablation. In this technique, the needle is using a microwave or radiofrequency wave which generates the local heat production. In this local heat production, it burns the thyroid nodule tissues, and over the period of time this nodular tissue shrinks and relieves the symptoms. We recently had a case of 60-year-old woman with difficulty swallowing due to enlarged thyroid nodule. We performed thyroid sonography to characterize the thyroid nodule. We confirmed its benign nature. After that, we performed FNSC test to rule out the thyroid cancer, and after confirmation of the benignity of this thyroid nodule, we performed a thyroid ablation in this elderly lady. During this procedure, we initially gave local anesthesia in the skin. After giving local anesthesia, we have inserted a radiofrequency ablation probe inside the thyroid nodule. After starting radiofrequency ablation, the thyroid nodule tissue started heating, and over the period of time, we covered the entire thyroid nodule. During this ablation procedure, adjacent structures like blood vessels, nervous system, food pipe or wind pipe is not damaged. After the single day hospital stay, a patient was discharged with no symptoms. We performed follow-up scan at 3 months and 6 months and noticed gradual shrinkage of these thyroid nodules and all symptoms related to this thyroid nodule. In this technique, we avoid open surgeries, we avoid scar formation, prolonged hospital stay and lifelong requirement of thyroid hormones.